Okay. Hey, greetings. Welcome to the Brain Gauge channel. And today we have a guest who is going to just talk about how she uses the Brain Gauge. So, Theresa, if you would just introduce yourself and tell us how you use the Brain Gauge and interface it with your practice.
Sure. Thank you, Mark. Well, my name is Theresa Horab. I'm a registered nurse. I live in Buffalo, New York. I have a little wellness center. And my primary therapy here is ISS microcurrent neurofeedback. And so I have been using the Brain Gauge in conjunction with that therapy. And I find it to be a great modality to acquire a scientific baseline. And even more importantly, it helps me to gauge the progress in which is occurring during my treatment with ISS. I'll be honest with you, initially, when I was first introduced to it, it seems like such a little simple tool. I mean, as a nurse, when it's simple, it usually isn't scientific, but that actually is not so true. In fact, there's lots of science for those that are very informational driven. Mark can guide you to a host of research. So as a nurse, of course, I'm science-based and evidence-based, and I love research myself. But nothing speaks louder than the results. And here's what I'm finding in my office. So what I typically do is I do a baseline prior to me initiating the treatment, so I could get a really good foundation of where am I starting with this patient. Although we do, verbal intakes and so forth, sometimes there's some skewed answers depending on, how the patient's feeling that day, who's present in the room. Where with the Brain Gauge, it's just nuts and bolts. We get a black and white description of what's going on. And then what I'll do is I'll do several treatments, and then I'll test again. And then towards the latter end of the treatments, I will test again. Now, from a business perspective, what I've done is given the patient's choice to pay individually for the Brain Gauge if they're just doing one-on treatments. But if they buy a package of neurofeedback from me, I've decided to include it because the bottom line is it's the best thing for them, and it's the best thing for me as a practitioner to have those results. So it's just easier to include things. When you give patients too many options, they get a little confused. So I include it, and I've increased the price of my package to absorb that cost. And honestly, I mean, the cost is so minimal because it's an 18-minute, I would say, average test to do the Brain Gauge, and the patient sits independent. So it takes me just a few minutes to set them up and a few minutes to conclude it. And what's nice is I could print out their results right there for them. And people like kind of something to hold on to. What I have found is if the results are worse than what the patient was anticipating, it obviously proves to them that they need my treatment. And honestly, if they're there, they probably need my treatment. But I've also seen patients where the results are not as bad as what we anticipated. And I think that does a whole nother thing for the patient, giving them confidence and hope. And so there's just no bad result. It's either it is what it is. It's the result. And it's not where you start that's important, right? It's where you finish that's important. So it's really nice. I have never done a Brain Gauge where people have gone backwards. Now, that speaks to my treatment, I realize, but it works as a wonderful tool for me to guide me to their deficits and also give the patient hope and encouragement along the way. So I've also decided to implement it in different sports arenas, especially with children, and offering it to patients and parents to get a baseline, because there's nothing worse than having a bad injury and maybe not understanding what one's baseline would be. So I think that's a whole nother twist and opportunity for people to use the Brain Gauge. But overall, I'm very satisfied with it. I think it's hand in glove with what I do. And so I appreciate you having me on, Mark.
Oh, I appreciate the comments. You've implemented the Brain Gauge very well in your practice and use it quite a bit. And as you mentioned, it really is a low-cost tool. And some people use insurance and it is covered by CPT codes and
Mhm.
cover the cost of it and relatively few patients if you use those codes. But anyway, thank you so much for your comments, and that's all for today. So thank
Okay.
okay.